Welcome to the Ultimate Dental Podcast, the place where you can learn how to create a dental practice and a business life that you love. Listen in with Dr. David Moffet as he interviews successful entrepreneurs and successful business people and successful dentists as they share their business successes, their stories, and their breakthrough ideas, sharing pearls of wisdom that you can take back to your practice and implement immediately so that you can have that great practice with more patients, higher profits, and less stress. This is the podcast where great dental practices meet with successful business processes. Thanks for tuning in to the Ultimate Dental Podcast, the podcast where thought leaders, industry experts, and thriving practice owners reveal their very best tips, tools, and strategies that will help you grow your dental practice faster. Now, here's your host, Dr. David Moffet.
Hi, everybody, and welcome to today's episode of the Ultimate Dental Podcast. I'm your host, Dr. David Moffet. I am in New South Wales, Australia, 2 hours outside of Sydney. And today my guest is Dr. Jack DeGruchy, and he is in Kelowna, British Columbia in Canada. And over there, I like to say he's 6 hours ahead, but a day behind. So it's about 8 o'clock at night, Jack. Is that right?
That's right.
There we
It's 8
go.
o'clock.
Well, Jack is he's the founder and president of the Canadian Digital Imaging Association, CDI, and he's had over 10 years, it's probably more, in providing intelligent dose CBCT image to enhance diagnosis, treatment planning, and clinical outcomes for dentists and patients. He's an expert in the field of cone beam computerized tomography, which is CBCT. And that's what's attracted me to talk to Jack, because CBCTs, in my opinion, are underutilized in the dental profession in terms of, one, their dental diagnosis, but also their ability to diagnose systemic issues and life-threatening pathology in some instances. So, Dr. Jack DeGruchy, welcome to the Ultimate Dental Podcast. Thank you for being a guest.
Thank you, David.
So, Jack, you, as we were chatting beforehand, you pulled me up when I said that you were a retired dentist. You said you are not a retired dentist because you're still out there educating dentists and helping them grow their practices. So I guess I'm fall into the same boat. I'm not retired. I'm just not clinically picking up a handpiece anymore. But for you, you are actively involved in helping dentists to improve their diagnostic skills in terms of the wonderful technology that cone beam has to offer. And I was very fortunate in my practice to have a cone beam installed. It was provided by, at that stage, I sold the ownership of my practice to a startup corporate, and they provided that. And then all of a sudden, the loophole that allowed, it was actually owned by a doctor, and the doctor wasn't able to bill the government for the diagnosis, and the corporate said they were going to take it out and give me an OPG machine. I said, well, leave the OPG machine in the plastic. I said, it's useless compared to a cone beam, because I knew exactly how much extra information I could gain from the technology of CBCT. So, Jack, welcome to tonight's discussion. We're just going to have a chat about your journey, what you're seeing, what you've seen so far in terms of cone beam acceptance and what people are doing with it, and what you see for the potential of it. But tell us about your current role so far in helping dentists with CBCT technology.
Sure. I practiced for over 50 years, so been through a lot of changes in dentistry, that's for sure. Early on, we were doing fillings and taking teeth out and making dentures, and then it's morphed into much more than that in the profession over the years. I've always tried to be on the leading edge of technology that was coming into dentistry, and sometimes that's a good thing, and sometimes that's not so good. I think one of my management teachers in dental school said, "Never be first and never be last." And but I tend to be the first, so I've had a few arrows in my back over time. But it's a fantastic technology. I saw when it emerged. I was working as a director of the Academy of General Dentistry, and I first saw it in the '80s, late '80s, Philadelphia. And I said at the time, if this is true, if this works, we're just going to lock and load one day. You know, you'll just know exactly where to put an implant. And in 12 years of doing this now for dentists, there's been just a tremendous amount of successful dentistry done that the dentist feels great about and that has worked well for the patient because they know where the stud is. You're not putting it in the gyp row. You're putting it in the stud. And that's probably one of the primary uses that dentistry's been using it for. I believe there's a lot more uses that it could be used, and I'm working towards that a little bit right now. But yeah, it for endodontics, for oral surgery, for finding pathologies, for TMJ, for implant planning, it's awesome because once I send, say, especially the full volume of the head and neck, because I have a full volume machine, and I send that out to, I use beam readers in North America, and they have 60, I think, radiologists working for them. So 1, 2, 5 of them might look at it, depending on how complex the image is, and give a very good report about the sinuses, about the TMJ, about any pathology, about the airway. And two things happen there. One, you're either normal, which is great for the patient to hear. In other words, don't go down that rabbit hole. Those sinuses are fine. That TMJ is fine. That airway's, fine. But the other thing you get is you're not fine. There's a pathology. There's an issue. You don't have enough bone, or your sinuses are an issue for you, or there is a pathology developing here somewhere in the mandible, perhaps. And we want to pick that up early because that's really important to the patient. If you can pick things up early, sometimes it's a lot different journey than if you miss it. And I think that the beginning point of bone beam should be used not only in dentistry, but it should be used in medicine. I mean, I'm in a socialized system here in this country, and I know that every day, all day long, many patients are going into doctors' offices with head and neck pain of unknown origin, and they're never sent to me to do a CBCT and send it to the radiologist. They're just left. Or maybe they line up for a year to maybe get an image in a hospital. So I'm working right now towards trying, and that's a big nut to crack, I know, but to try to get the medical profession and the interior, what we call health system in our area, to understand what we have here and what dentistry's been doing here. And that when patients are suffering, we need to find out as early as we can what is the reason for that. And so CBC is a great diagnostic tool. It's a great treatment planner. And I mean, maybe you have to go up the ladder to MRI, and maybe you have to go to brain scan because what the patient's telling you is pretty darn serious. And we can do that. I mean, we do it in dentistry where we constantly refer people to sources of specialists or GPs that are really into certain treatments. We refer them and they get I think they generally get a very good treatment and a very good outcome. And that's just us doing dentistry. But there's so much more that this could be used for I believe, to help patients understand more about their own health, right? And so I right now have an oral medicine specialist, which is new to our area, who is just doing oral medicine, oral facial pain, and TMJ. So I believe that once in place with all the CBCT capabilities that Canadian Digital Imaging has, we're going to be able to probably push out a really pretty good diagnostic understanding of a patient. In fact, I got thinking the other day, we have a shortage of doctors in Canada. So why wouldn't a person who's suffering from head and neck pain or even a tummy ache come in and talk to us. We would spend a lot of time to understand them. The oral portal is a big deal going into the body, right? And the tissues and the teeth and the throat and everything about the airway and the sinuses can tell you quite a bit. And I just feel that, in fact, I've sent my daughter and one of my granddaughters through that method to him because I felt that he would take more time and really try to understand what they are experiencing. And that even though we may not have all the answers, it's a heck of a good baseline to start with a full CBCT and a radiology report. You now have a real nice baseline of information on this patient. And then you combine that with a great medical history, take it, and especially with oral medicine doctor now, really good blood work, and maybe even go, I'm thinking we want to go to genetics too, and take, because I've had that done, full body imaging, full genetic workup, full blood work to look at the hardware and software of my body. And I didn't want to hear bad news, but the reality is that is the software and hardware that might help my children or my grandchildren know genetically what they may have or face in their life. And so I use my body as a test to see if there's anything there that might be of benefit to them. So I kind of I get into it a little bit. That's for sure. But I'm not a real expert. I don't have all the answers.
Isn't there in the CBCT? You know, I was talking to a lady this morning, a hygienist, and she was telling me about a case where a patient had presented with jaw pain, and the dentist had taken a CBCT and just looked at the panoramic image, and nothing showed up. And she looked at it and she said, I can't see anything on it. And then she went to the slices, to the cuts, and all of a sudden, as she's going through, she's found what ended up being a tumor in the mandible, and he had to have a molar removed to get access to it, to get it out. It was a significant, but it didn't even show up in the Panex part of it, and that's the scary part. You know, you might think, oh, I've got a panoramic X-ray. It's not doing the work. We need to upgrade it. We need to have more people looking at CBCTs. And if you don't know what you're looking at, they've got to know that they've got to get somebody to look at it thoroughly and look at the bits and pieces of it and say, you know, there's a tumor up there in the parotid, or doing full head scans now. What we're doing is life changing. And especially with the increase in oral cancers that we're seeing now in 40 to 50-year-old people, these were things that we didn't see before. You know, lifestyles have changed to have these things now occurring and increasing. And I heard, you know, that the number one lawsuit in dentistry used to be periodontal disease, but hot on its tail is misdiagnosis of oral cancer, which is far more life-threatening. So the CBCT is an important diagnostic tool that dentists need to own, and if they don't know how to read it, they should be getting a specialist to read it for them.
Yeah, the radiologists that I am working with, they're fantastic. I mean, they sit in the dark all day long, and they have a very sequenced way that they go through that image, right? Whether it's just a 10 by 5 or a full volume. They have a very sequenced way that they look at that. And that's really great for the dentist to have that report. You don't have to know everything. I think some people are, like, I remember the orthodontic profession when I was with the Academy of General Dentistry, was dead set against taking a cone beam. And it wasn't because, and the reason for that is they were afraid that they might miss something. And I'm like, who are you in this for right now? Are you in this for the patient, or are you in this for you? And that's a big distinction, right? And I don't mind admitting I may make a mistake but because I don't know everything. But I'm in the best interest of the patient. If I get great information on them and put it in, if I don't know, put it in the hands of somebody like a radiologist who looks more. And I think AI is coming. And my understanding with AI is it can see more shades of gray than we can. And so AI will be an assistant to radiology. And in the best interest of the patient, you're saying to them, you're normal. And they like to hear that. Or you're not. And if you're not, who should be seeing you? And we have a lot of resources in dentistry and aligned with medical. We have a lot of resources that can help people.
Yeah, really, really important that AI is now taking, and excuse the pun, but it's really taking the grey area out of dentistry and helping to make it more black and white. Because if a patient goes with a set of radiographs to one dentist and then another, there's a good chance they're going to get three different opinions. But if they go to AI, it's like, this is what the computer says we have to do. So the AI part of reading the shades of grey, and especially in a CBCT image, which has so much information, there's more treatment there to be done by the dentist and then by other people as well, than just say, what's the old saying? We're going to watch that. We're going to put a watch on it. Once a watch is put on it, it never gets done.
Yeah.
It just gets watched get bigger.
Yeah.
And that's not the answer, especially in soft tissue pathology. We want to get rid of that darn thing while it's small.
Yeah, no, I think there's a great future continuing to come in dentistry. I often tell my patients, I can't see in your head, but my robot can. And then they walk in the room and they take a look at my, I have a Carestream 9600C, and it looks like a Star Wars soldier. Like, it looks the part, right? And within a minute, I have full volume coming on the screen, right? They go, for 12 years, every patient I have has said, wow, wow. And I said, this is wow. Because before, like I explained with 2D, I tell them, look out the window and you see that great big high rise over there behind all the trees and the buildings? And they said, yeah. And I said, well, 2D, taking a picture of that with all those overlapping structures between those buildings and us, could in fact even be a lie, could be not the truth. But 3D is a satellite up there that sees in every room of every building in every part of this part of the city, and every person in every room and every box in every room, and that's 3D. And that is a way different than 2D. And so I love, I mean, after 12 years, I still, every time I take an image 5x5 or whatever, I still go, wow, that is so great to have for that endo. That is so great to have for that bone, that the bone has taken, and now there's a good site to put an implant in there. Or, yeah, you have some trouble with your sinuses, but probably not, life-threatening, but you do have some kind of thing, that allergy or whatever, that is affecting your sinuses a little bit. And some people are really affected in their sinuses, and then they should be seeing ENTs. And I can't believe in my system that an ENT doesn't refer to me. The doctors that come to see me for treatment dentally and the nurses all say, how come patients can't see you? You have to kind of come through the dental portal. And I'd say, yeah, try to figure that out. Like, that is insane, really. But that's when we're locked into systems, and we have to continue to deal with that, right? And there too as well. And so anyway, I love CBCT. I love helping patients. I love helping doctors. I drive an old car so I can have a Lexus in my room, right? And I'm quite happy to do that, right? So I don't call myself retired. I just call myself, I'm engaged. I have a very good philosophy about some things. One, you take a sheet of paper and divide it in 4. In 3 of the quadrants, you find out the things that you most love to do in life. So for my example, I love dentistry and CBCT, and that's one of my quadrants that I'm constantly studying. And then in my other quadrant, I built a foundation that honors the past to do good today for the future. By everyone donating an hour, and if it comes as a guide, give it to Rotary, let them go to work in your town, and they will really do some good work. That's my purpose in life, right? And the third quadrant is my love for my children, my grandchildren, for my patients, for you, for my Rotarian friends, for anyone I meet. And now I have my 3 quadrants that I stay focused in with my time, energy, and money. And then a very wise man told me, and anything that doesn't fit in those three, Jack, you put in the fourth quadrant called the devil's vortex. And that's where you're drinking too much, you're wasting too much time, you're wasting money that could be better used. You're just wasting, right? And that has been such a great sense of understanding of what's important for me to work on, right? So I don't know what I will never use the word retired. I'm sure that that word does not resonate in my brain. I just want to stay fully engaged, and I want to keep helping, and I'll do my best while my light is. That's it.
That's a nice way to live. Um, a really nice way to live, to put things into their compartments, in their buckets, and make sure that you don't get them overlapping, and you just keep them simple.
Stay focused. You know, it's a bit of a focus on each one of them, but you realize you've found out what's important to you, and when you find that out, you get up in the morning with purpose. And you can't do it all today, so you get up again tomorrow morning, right? And I speak to patients not only about imaging, but I always have extra time for them. And so then we go into this, what I'm talking now, which is more about life. You know, how are you really doing? How are your children doing? How's everybody in the family doing? And get into that a little bit here, and because it's important. And we need on Earth today, we need that hope. We need that light. We need to shine that light, and we are doing it. I think there's a lot of people doing a lot of great work on Earth, but there are certainly some things that are taking hope away from some of our young people. You know, like I have six absolutely beautiful granddaughters between 19 and 29, and they are not really thinking about having a child. And we are a strong family, generational family unit, right? And they're like grandpa. The inflation, the war and rumors of war, the climatic events that seem to be happening. Um, what do you think? And I have to say, I can't force them to say you should have a family, but I can appreciate how they're feeling, you know, like, so I really try to keep working on building hope, and that we as a human race can do better. That's where I will probably work in podcasting. I think in there, I think there's some really good things coming along there with peace mediation, and I'm learning by peace mediation stuff. I learn beyond dentistry, right? In one of my quadrants, and I've really learned some good things about how to communicate. Say a husband and wife, um, cut a little slack and grace for each other. You're both human. You may say and do the wrong thing from time to time. Because I was married 50 years. Gayleen passed away at 7 years ago. She was an amazing saint of a person, right? She really was a beautiful, and she was a teenage counselor, right? Amazing person on there. But so from my experience of marriage, I know that if we can do that, then think how great the marriage can be if you'll just cut a little slack. Don't turn your back. Don't walk away. Don't turn cold. Don't do that. But accept that we each see it a little differently, you know? And so that can be two brothers and sisters. That can be two business partners. That can be two world leaders, for goodness sake. On there, cut a little slack for each other and see that you each come from a different perspective. But if you bring those two perspectives together, you have something that is unbelievably or to do good.
That's
If you will just have the empathy and the ability to have a silent mind and an open heart, right? I think it's amazing what can happen, right? So anyway, that's where so every patient I see, we talk, we do imaging and we talk because I have the time. I'm not doing a filling. I'm not running to another room. I'm there for that person in that moment of their life to do the best thing I can in my one quadrant of dentistry, my other quadrant of doing good on earth, and my other quadrant of loving them as an individual, right? And every time they leave, they're like, wow, thank you. And I say thank you to them because they teach me things too, right? They say this or they say that, you know. And there. So anyway, I know I'm getting off topic, but that's diagnosis, that's treatment planning, that's listening to what they're experiencing And the imaging can really help, but so does the listening, and so does the examination process, right? The gathering of
It's very good
information.
for building trust, Jack, and that's relationships, especially inside the mouth, inside the body. People can't see what's going on, so they have to trust. And so, if you don't have
Yeah,
that
yeah.
trust, there's doubt, and doubt's not good for anybody's health. Um, can you tell me some of the common diagnostic errors that you've seen from other people in their poor interpretations of CBCT images? Is that just from, do they read things wrong, or do they just fail to know what they're meant to be looking for, and something that they should be able to know they're not recognizing? What are the errors that practitioners are making?
Well, you've got, of course, in dentistry, you've got generalists and you've got specialists, right? Um, four of my key referrers are periodontists, and they don't see having their own machine. They're quite happy to send the patient to me because I affirm the patient that you're lucky to be in the hands of Dr. T or Dr. S or whatever, and they're very, very trained in this area, and they really do care to get a great result. So implant planning has been one area where you definitely do not want to be without CBCT doing that. I mean, we've done it. I did it for years before CBCT. We did that by experience and feel. But in today's world, definitely you want CBCT for implant planning. Endodontics, I think anybody doing endo where it might be a little difficult, why not have a great view? Why not take some time to rotate the tooth, try and look for a fracture line to see if there's an extra canal or that root really curves on us right here and there, and really have it in your mind what it is that you're up against when you enter into the tooth to do the root canal, right? So I think it's very good for root canal work too as well. Okay. Um, I'm not sure the emerging uh, treatment of sleep apnea. You definitely have people who are suffering, and that even from a developmental standpoint, in a young person, could we pick things up easier with cone beam that would help us understand what seems to be going on in terms of the development of this individual and how orthodontics or something may change things to their favor in order to have a better, not only occlusion and a smile, but perhaps a better airway too as well. So I think that there's some work that's going on in that field that we're going to benefit from to help people when they're younger. TMJ, for sure. If you're doing much work where you're doing big restorative, I would have a very careful look at everything before you undertake a big restorative case. And so I think TMJ is generally it's pretty forgiving, the TMJ, right? But over the years there. But that being said, when you really do understand the anatomy and where it's at, and that you could get things kind of organized before you go to that restorative phase there. So anybody doing prosto, I think CBCT can be really help to do early treatment planning, early diagnosis and treatment planning before you just jump right into cases in there. So and then pathology, if there's anything showing up, my oldest daughter just went to her 40th high school reunion. Wow. So anyway, one of the families that she grew up with, friends of ours, the mother just found out on the Thursday before, it was Friday they were having the reunion, but on the Thursday she just found out that her 59-year-old son, and my daughter's 58, 1 year older son, had just been diagnosed with massive cancer of the
Oh
enamel,
no.
and that was missed, right? And this poor mother was trying to take this in, right? And there, so anything we can do that's just more thorough, and we can maybe pick up early. Let's do it. Let's do it. And I've had so many images of myself done. I don't worry about whether there's some little radiation here or there. Man, if you're in a car accident, they're going to throw so many X-rays at you to restore your whole body right? And there, so in terms of having a cone beam done, it's nothing compared to the value of what you learn and understand to treat or not to treat, right? Too as well. So I think that, yeah, just early pathology diagnosis, and what can you do with that? With cysts or different things like that. I think in the hands of oral surgeons and maybe other people who love surgery, right, on there too
Tell
as
me,
well.
what was
But
with
yeah,
that diagnosis of cancer of the mandible? What were the symptoms that
I haven't. He's not a patient, and he's just somebody that's a friend of a family. So I don't know much about the particulars of this. Say this last year for him, what was he feeling? Like, what was there something that he was feeling there that was a little bit untoward, but he just didn't know, and then if he just carried on month after month after month, just thinking, well, that's probably normal. Maybe it's just a muscle, or maybe whatever. There would have been really nice to have picked up. If he would have had a cone beam early on, it might have picked it up, and then we send it up the ladder and get it in the hands of cancer specialists and do what they do, right, on there too as well. To me, it spoke that yeah, we can't take for granted that you're 50 years old and you're not going to be. This was a death sentence for him,
right?
right? This is serious business, right? On there too as well. So, and I mean that's a one-off in a way, but it does speak to the fact that you assumed he was healthy, you assumed he was young, he was a friend of the family kind of thing, and yet we all
Somebody
missed
somehow
that. Somebody
Dennis
somehow
missed it,
Dennis
and
missed it, Madison missed
until it was real.
until it was really a little too late, and so so we do see that from time to time there, um, and like you say with cancer, it may be changing. Our food sources are changing. Um, you know, um, these kids are drinking bull drinks, and they go into a coffee stop thing in the car, and there's like 40 different syrups they can put in to spice it up for them, and so in our day it was Coca-Cola probably. When I go back, I think how Coca-Cola marketed, and we all would have a Coke there and in there, but really. I don't. I wouldn't want my grandkids to have any more of that than they
Mm,
need, right? Because who knows what's happening to their tissues when it's constant every day, and they're in their 20s,
yeah,
right? And that's going to play out. I think that's going to
yeah.
play out on there too. But that's just early diagnostic of cancer. Maybe we can all improve with whatever method we're using to try to diagnose early on. Let's keep at it because technology is
All the
evolving,
time.
and it's
But lifestyles are dictating different changes in what people do, what they eat, what they consume, what their risk taking is. We've only got to
yeah,
look at the that color chart of the United States, the obesity chart every 5 years, and just see how the whole country's now dark blue, and people their cure
oh
for
yeah,
obesity is
oh,
statins and buy bigger clothes. That's the answer. That's not the answer.
yeah. Uh, or they're trying to use drugs to deal with it and finding out that that's kind of a
Mm,
problem too in there. So, so our generation coming is going to maybe be facing things that you and I didn't face and our parents didn't face, with just change in culture, how food's delivered to us, right? So and that's of course a bigger global issue of what's going on with drought. We've got drought in Canada, right, on there, and that's affecting the crops. I live in property. This way, we had a fairly cold winter, warm time, and then cold. Now, my apricot, there was no apricots, no yellow plums. Grapes got hit 90%. 90% of the grapes were lost in there. So you imagine owning a big, beautiful winery and you just lost 90% of your grapes. And that just happened this year, right? So there's impacts going on with climatic events and globally that's going to play out in our food sources. And then maybe what I'm seeing, like I look at the world that they're coming up in and look at the inflation and whatnot. And so if foods becomes very expensive, then they drop off to a less quality, right? They can only afford certain things now. And it might be in the middle of the store, not on the outside where the good
Yes.
food is, right? Now they're in the middle of the store and buying the junk. And so um, I mean, I don't have all the answers, but when we see a patient, I think we should talk to them about everything. How are you really
Yeah, for
doing?
sure.
And then they'll cry. I'll guarantee you, some of them will just
Yeah.
cry. They'll just, and you are their
Yes.
doctor. You are seeing them every 6 months, and you see their head and neck, and you even see their body profile, and you see a lot that you could maybe work with them somehow, learn to communicate with them as to how they might be able to move and change and make the odd change in their life, and you help play a role in that if you can. Like I do, I'll tell you one thing. I learned through peace mediation a little bit. So just a few months ago, I decided to talk to all my grandkids and say, if you're willing to have lunch with Grandpa once a month, I will buy you lunch for your birthday every month. But we are going to do three things. And we're not going to talk about the weather and we're not going to talk about sport. We're going to talk about what's your greatest challenge right now. And I'm going to tell you mine. And then I say to them, what's your greatest win? And they tell me. And then I tell them mine. And then I say, what are you going to commit to for the next month? And they tell me, and I tell them mine. And one of my gorgeous granddaughters, who's an absolute tremendous athlete on there, I asked her the question, what's your biggest challenge? And you know what she said? She said, Grandpa, I don't know how to eat. I don't know. I've never, I just, but she's high-end athlete, but I know that her habits that she's had through her teenage years and early 20s now, they're not going to bode well unless she changes things, right? And so I think I'm trying to do that with my grandchildren, but I think we have the capacity to even do that with a client and say, what's your greatest challenge? What's your, and get into a really deep conversation
Yep.
with them in there. And now they get to know you, you get to know them. Now, like you were saying, David, the trust level goes up because they know you care. And it isn't just about teeth and it isn't just about
No.
money. Okay. Because quite frankly, I am ashamed of having lived in Canada for the last 55 years and watched what's happened to our country. The fact that when I was young going to university and making money by roofing, I would put a roof on a house in a day and I would be paid $1.10 an hour and $11 for the day, 10-hour day to put that roof on. And now my grandchildren have to buy a house that's worth 1.1 million. And I'm saying, what went wrong in the state of Denmark or in the state of Canada or in the country of Canada? And I feel that that's been on my watch. And that's why I'm doing the work that I'm doing to do whatever I can to make it better. And it is not about the almighty
No,
buck
it's
all the
not.
time. There's so much more to life. Anyway, I
You have
digress.
digressed again, Jack. Where do you see the future of CBCT, imaging heading in the next 10 years? Where do you see it going? What do you think we're going to be able to do with CBCT in 10 years' time that we can't do today?
Yeah, great diagnosis. So probably very good orthodontics, properly diagnosed, properly treated out early on, getting kids to have great faces, great joints, great smiles. It'll play out in orthodontics. Any person who needs to just be more functional because they've really been destroyed, looking at what treatment plans where you can add bone or do so many things that will allow for a singular implant for a tooth or multiple implants for bridges or dentures. They're really some beautiful, stable work that the patient benefits from facially, TMJ, just comfort wise and feeling great about themselves. I see some great stuff with dentistry there. Just being able to look at the whole face and plan the facial treatment, like the aesthetics of the smile line and the vertical dimension, looking at it all digitally before you go working clinically. I think there's for those that are involved in that kind of work, there's going to be some great things happening, already is there and happening. The fact that AI can read it better, so we may find earlier pathology
Yes.
earlier, and that would be on there. Airway and sleep, helping develop it early on. But if you missed it, then what is it that we can do to help people perhaps not have a stroke or to have a heart attack or some of the things that can be happening because of lack of oxygen and just not breathing properly, not sleeping properly. There's some great things I think will come along there too as well. And yeah, no, I don't know about joint. I don't see many patients with joint surgery, but will there be times when a car accident or a veteran or something where they really need some help being restored, with maybe joint surgery and whatever. I'm not sure. In my era, I didn't see too many successful ones of those, but I did see a lot of research going on and people really trying to understand: do you leave well enough alone, or do you get involved surgically here? And I've had patients where they got involved surgically and then they really kind of regretted that actually. So you got to be careful with that one a bit, but I think there's great things coming to maybe have that happen for those that need something pretty dramatic on there. Yeah, and then just even having your image that you've got, and now you happen to go through a windshield, and now they know how to rebuild you. They know exactly what your cheeks are and your mandible, and they've got the information right there. That was there in storage, so like it's not a bad record to have if that
Yeah,
happens, right?
they
In
can
there too.
see
So
they can
so
see
who
who you
knows?
were.
So that's kind of what I see. I guess that's what I see, and more people will use it. More offices will have it, and but sometimes there's a place for not always putting your name on a lease, right? For more and more equipment, doctor of dental supplies. Sometimes I could have had all my own lab work that I could do, but the people who do lab work are fantastic at it. So let them have a life, let them make a living, let them be great at what they do. And same with CBCT. This is what I do. You don't have to buy the equipment. Send the odd patient, it'll be well handled. You'll do what you're supposed to do, and you won't have this lease gnawing at you every month, right? And there, because that happens, you get an anchor around you in a big practice maybe, and then who knows the future? Like real estate's getting kicked around in Canada right now, and so nobody knows the future there. So be careful of that. I think why not just support people who are in that, and they can help you, and you don't have to have everything all the time. I'm old enough to say that,
Yes,
right? I've made my
yeah.
mistakes, right? And there with
Lot of good
anyway,
advice there, Jack. And I think the key the key thought is that if a dentist doesn't have a CBCT machine, they should have one. And if they don't know how to read the CBCTs properly, they should send those images off to somebody like you who can thoroughly go through and diagnose what you see, as opposed to I took a CBCT, but I didn't know what I was looking at, and I missed an oral cancer, or
yeah,
I missed pathology in the full head that I should have
yeah,
that I should have
yeah,
gone. And that's the important thing in this day and age. When I mentioned before that the the growing uh, curve of litigation in dentistry is now oral cancer is accelerating, in terms of litigation because it's being missed, and it's being missed because
yeah,
one, people don't know what they're looking for, and two, they don't know how to look for it, and three, it's not rewarding for their practice if they find an oral cancer, because that patient then leaves their practice to go and be treated for the oral cancer, and they don't get to do any dentistry. So we need to work out how to balance that equation, because we want to keep people alive and we want to get them diagnosed early. This is our patients, so that
yeah,
they have a more fulfilling life. It's a conundrum.
yeah, yeah. Yeah, I obviously faced that idea like 12 years ago that I was taking full volume head and neck imaging and so it would be easy enough just for me to say, hey, I'm afraid of getting sued. I don't want to be having this. I don't want to have any more. But I came from a different perspective. I came from the patient's perspective that this CBCT imaging is fantastic for small volume root canal or implant planning. It's fantastic for looking at the joints and the sinuses. It's great in a full volume to look at everything thoroughly. And so I just right away aligned myself with friends that had a big oral radiology company, right? So they have 60 radiologists that they work with. And AI is going to aid them even to even do a better job of reading. There, if our eyes only see, say, 25 shades of gray and the AI can see 250, then it's going to be probably helpful for a radiologist to be even better, right? And that's what it's about: constant improvement, constant kaizen, right? 1% improvement. Stay at it, right? But it's for the patient. You've got to do the best figuring out of what's the best treatment. Nothing. Sometimes nothing's a great treatment on there, or what else? What's the best for them? And if you come from that perspective, then I don't worry about the lawyers because they're making a living. I get that in there, but I really think that as long as you're doing really good imaging and you got radiology people to have a look at when it's more information than say just one tooth area, most dentists are very capable of looking at that. They're not going to miss much in that. I don't believe they will on there. But if it gets to be a bigger volume of information, that's when it's really nice to have in your chart a radiology report that the patient is healthy in these regards, but there is concern in this regard. And now, don't try to be a hero. If you don't think you can treat that, get that away. Get that to a periodontist. Get it to an oral surgeon. Get it to an endodontist. Get it to somebody if you're not comfortable with this, right? And that is in the best interest of the patient.
Always.
Right?
We have to be operating in the best interest of the patient all the time.
Yeah. Yeah.
Dr. Jack, we could talk for hours on this, and I love how we're aligned in terms of using technology for the best results for the patient in terms of helping to diagnose early, diagnose more thoroughly, and get the patient healthy as quickly as possible, as opposed to and I've heard it in not orthodontic lectures that I've been in, but orthodontic lectures that some of my clients have been in, where the lecturer has said, look, I'd rather we just extract a couple of premolars and get the bands on so you start making some money. But that's not the best result for the patient. That was a scary comment when I heard that from one of my clients, and I thought that that's really creating scarred faces. It's horrible.
I go back a long ways, 50 years, and I traveled to Moscow, Copenhagen. We were in Stockholm, and it was 16 of us on a people-to-people exchange of dental information, and I clearly, because I had 100% overbite, and so in dentistry as I was studying, I knew that you cannot collapse the face. You cannot allow teeth to be taken out. And as a general dentist, I would talk till I was blue in the face, and then the parent would say, well, you're not a specialist. I'm going to the orthodontist. And in those years in America, most of the treatment was taking 4 bicuspids out. And so if you look at the Judd sisters and the mother and one sister are gorgeous. The one who happened to have enough money at a certain time to go to the orthodontist lost her face. She looks like the mother. She looks old, right? So, and in Sweden, when I was there, the beauty about that was that they would have 6 orthodontists in a classroom, in a school, that would go to a school, and they would look at all the kids in grade 4, and they would find the kids that need to be developed. And then around grade 7, then they would put the brackets on and line it up. But they'd already developed them. And they were way ahead of what we were doing in North America, especially in the United States. They were way ahead of what we were doing. And I'm so glad that has changed for better diagnosis orthodontically to know how to try to preserve the face, right? And there are a lot of, like most of the, in those days, all of the beauty queens from Texas and Arkansas and Australia, they all were
Yes.
proclined. I have one granddaughter like this. My one granddaughter is like this, right? And orthodontically they brought her back a bit, but I looked at her all 3D, right? But she's the queen, right? She won it because she was so proclined. She had a fantastic smile, right? and so point is, we can all keep learning here. We must never think we know it all, and sometimes we get a little I don't know, boy. Just stay open to other ideas, stay open to other cultures, stay open to East versus West mind. Don't think you've got it all nailed down because you have
No.
not. And there, and so that's a whole other.
That's a whole other subject, Jack. It's been great chatting with you on the Ultimate Dental Podcast. If somebody wants to get in touch with you, what's the best way for them to find you?
I would go with my email, jack@cdikelowna.com.
All right, and you've got a LinkedIn profile as well, and you're also.
I haven't looked.
You haven't looked at that for a while.
There, so I haven't looked at it for a while.
And also, you're
there's so much to do, eh?
You're also an educator with Advanced My CE now as well, so we can find you on there as well, and we appreciate your participation on that platform.
Okay.
All right, Jack DeGruchy, thanks very much for being a guest on the Ultimate Dental Podcast.
Thank you for tuning in to another inspiring episode of the Ultimate Dental Podcast. We appreciate each and every one of you for being a part of our dental community and joining us each week on this incredible journey. If you found value in today's episode and you don't want to miss out on future episodes packed with expert insights and actionable strategies, here's how you can stay connected with us. Firstly, hit that subscribe button. Whether you're listening on your favorite podcast platform or watching on our website, subscribing ensures you'll never miss an episode. Secondly, share the love. If you know a fellow dentist or colleague who could benefit from the wisdom and knowledge that we share here, please share our podcast with them. Also, please share the podcast on your socials by simply clicking on the social icons wherever you view or listen to this podcast. Together, we can all do our bit to elevate the dental profession. And finally, stay engaged with us. We love hearing from you. Your questions, comments, and feedback fuel our mission to provide the best content for your professional growth, your personal growth, and for your practice growth. Remember, your journey to creating a dental practice and a business life that you love is our mission, and we're excited to be your trusted guide along the way. Thank you for being a part of the Ultimate Dental Podcast. Until next time, keep smiling, keep striving, and keep on tuning in to the Ultimate Dental Podcast.